Hello, I'm Karen Cantu, the Director of Public Relations for the Metropolitan School District of Perry Township in Indianapolis, Indiana. Welcome to the first in a series of programs dealing with the wellness environment in our schools. We all know that kids will be kids and minor cuts and scrapes happen all of the time. But before you dismiss them as no big deal, your faculty and staff need to consider the possibility of exposure to life-threatening blood-borne pathogens. While this program is not intended to teach you how to be a first responder or how to administer first aid, you will learn what blood-borne pathogens are, how they are transmitted, and what protocol to follow in the event of a bodily fluids exposure. To gain a better perspective on this matter, let's visit Katie Thomas, registered nurse and supervisor of nursing services at the Metropolitan School District of Perry Township. Katie, welcome and thank you for taking the time to meet with me today.
You're very welcome.
Now, I understand that blood-borne pathogens are an important topic, but it's not a very pleasant one, is it?
No, it's not very pleasant, but it is important. Working with children in a school environment means expecting the unexpected. When medical emergencies happen, you must care for the child while also protecting yourself and others. That's when the knowledge of blood-borne pathogens is important.
What exactly are blood-borne pathogens?
Blood-borne pathogens are microorganisms that are present in blood and or body fluids and can cause diseases including staph, hepatitis B and C, as well as HIV. Most exposures to these pathogens do not result in infection because intact skin will prevent the transmission of the pathogens. Most often it requires an opened wound, such as a cut or a scrape, or into a mucous membrane, such as your eye, your nose, or your mouth. Blood-borne pathogens are also potentially transmitted through vomit, urine, feces, or saliva.
So then, our classroom teachers really do need to take precautions.
Actually, the term the medical community uses is universal precautions.
So what are those?
Universal precautions is a preventative approach to infection control. According to the concept of universal precautions, all blood and body fluids are treated as if known to be infectious for HIV and other blood-borne pathogens.
So now we've defined universal precautions, but what exactly would they look like in the school environment?
Universal precautions for spills of blood and body fluids in the school environment are as follows. Wear gloves if there is even a possibility you might have contact with blood or body fluids. Clean up spill with paper towels or other absorbent material. Clean contaminated area using a school system approved disinfectant. Gloves should be peeled down from the top so that they will be inside out after they're removed. Dispose of gloves, towels, dressings, and other waste in sealed doubled plastic bags. After the removal of gloves or after exposure to blood or other potentially infectious materials, wash hands with antibacterial soap. Remember to remove your soiled gloves and wash your hands before touching any cabinets, doorknobs, or items other people may come in contact with. In fact, the most important protection you can use for preventing the spread of communicable diseases is to wash your hands.
This is important information for our teachers.
Not just our teachers, but our entire staff. Let's look at a few scenarios in which a school staff member comes in contact with blood or body fluids. In this first example, a child has fallen down at the playground and has a skinned elbow. This often frightens children, and there's no reason not to respond with compassion as long as you employ universal precautions. If possible, place a barrier between yourself and the injury, such as a paper towel or tissue. Do not touch the affected area without gloves. Next, take the student to the nurse's office where the nurse will apply gloves and direct the student to wash the injury with soap and water. Then, pat the area dry and cover it with a bandage. Remove gloves and then properly dispose them into a trash can along with the paper towels. If blood is present, place the materials in a separate plastic bag and place that bag in another plastic bag and dispose. Wash your hands thoroughly. Here we see a student on a school bus with a nosebleed. School bus drivers are presented with a little more challenging environment. Therefore, all bus drivers should have gloves, paper towels, and trash bags in their first aid kits. The school bus driver gives a paper towel to the student, instructs him to hold pressure until he can apply gloves. The bus driver then applies direct pressure until the bleeding stops. Upon arrival at school, the bus driver disposes of the gloves and paper towels in a trash bag, double bags it, and disposes of it. The school bus may need to be cleaned if there is blood on the seats or bus interior. Be sure to use an appropriate disinfectant. The bus driver should wash their hands upon arrival at school. It is not uncommon for a child to vomit at school. When this happens, the teacher or office worker should call for the custodian to clean the area, as well as keep other students away from the body fluid. Next, take the student to the nurse, who will put on gloves before helping the student. If the custodian takes a while to arrive, cover the spill with a paper towel. Do not touch the vomit without wearing gloves. To clean up the body fluid, the custodian will first put on gloves, then apply an absorbent product to absorb the spill, or use paper towels. The custodian will place the soiled material in a plastic bag and disinfect the area. After the disinfectant has had time to work, the custodian will soak up the remaining disinfectant and place the paper towels and soiled material in a doubled bag, dispose of the bag appropriately, and wash their hands. Shop class equipment or sharp instruments in a science lab may lead to a bleeding injury. In this event, keep everyone away from the injured person. Provide a paper towel or tissue and have the student apply pressure while you apply gloves. Contact the school nurse immediately. The school nurse will apply gloves and make a medical decision on what to do. To clean up any spilled blood, call the custodian. If the custodian takes a while to get on the scene, be sure not to touch anything without wearing gloves, and keep everyone away from the area until it can be properly disinfected. The custodian should apply universal precautions in cleaning the spill, making sure to properly dispose of any broken glass that might cause further injury.
Now, Katie, let me ask you about this situation. It involves a fight between students. As I'm sure you know, most school fights don't lead to bloodshed. But when they do, it's often the teacher or staff member that stops the fight who winds up with students' blood on their hands or clothing. What is a good strategy for dealing with this situation?
In an emergency like a fight, you probably don't have time to find gloves, but you can use a barrier to avoid direct contact with the blood. A thick layer of paper, paper towel, or a clean plastic bag. Again, use direct pressure to stop the bleeding and take the student to the school nurse. As soon as possible, follow protocols for blood exposure and wash your hands thoroughly with soap and water and dry them with a paper towel. If a student has blood on their clothing, a change should be made. The clothing should be removed by the student or parent and bagged for laundering at home. If the contaminated clothing is the employee should remove the clothing as soon as feasible and launder it. Fortunately, Karen, the overall risk of contracting a disease from a blood-borne pathogen in a school setting is very small. And while not every exposure can be prevented, following universal precautions and knowing what to do will make it easier and safer to deal with the unexpected. In any event of this nature, be sure to follow your school's protocols.
Katie, thank you so much for taking the time to share this information with us.
You're welcome.
And thank you for your participation in this program. For more information about blood-borne pathogens and universal precautions for protection, speak with your school's nurse or visit the Center for Disease Control on the web at www.cdc.gov.